Thank you very much for that introduction. We did have some previous sessions during a GBCC earlier with survivors. However, it's been a while since we had a session where we get together with our survivors and patients. So it's a pleasure to be here. And the presentation that I'll be delivering to you today, the causes and incidences of breast cancer. I'll first of all deal with the incidence-related issues first, and then deal with the risk factors and causes in the latter part of my presentation. Mankind has struggled in order to overcome various types of diseases, and some of the successful cases you are probably aware of will include polio. In 1988, there was a major campaign on a global basis to eradicate polio, and in 2020, polio cases have declined by 99.9%. So we believe that polio will soon be rid. In 1971, the U.S. government has launched a war against cancer. However, nevertheless, the burden of cancer incidence and mortality is still growing on a worldwide basis. So 19 million cases of new cancer cases has been witnessed last year on an annual basis, and that has caused also around 10 million cancer deaths. So cancer is the first or second leading cause of death before the age of 70 years. So in the majority of countries around the world, breast cancer is still the #1 cause of cancer or type of cancer in women. Breast cancer takes up about 24%, of all cancer cases. And according to our statistics of 2020, there have been 2.3 million new cases of breast cancer, among which 685,000 deaths have occurred. So for women around the world, in terms of mortality as well as incidence, breast cancer is high up on that list. There are some differences by nations. For example, there are many countries like Australia and New Zealand who have a high incidence of breast cancer in their population. Looking at the incidence per 100,000 people, about 96 cases in Australia and 93 cases in New Zealand. And we also see a similar situation in North America, such as the US and Canada, and also a little lesser than that, but still quite prevalent. We see a high rate of breast cancer incidence in the European nations. So 1 out of 8 women in the Western countries are breast cancer patients. And in Asia, that rate is a little bit lower. Looking a little bit more closely into the incidence rates in Asia, on average, for example, if you look at Indonesia, Malaysia, they have a bit lower cases, but Korea is rising very high. Vietnam and other countries show a lower level of incidence. So the high level of incidence really shows that there is a linkage in terms of the causes of breast cancer increasing due to changes in lifestyle, but also screening has developed, and that's why we see a higher level of cases. This is based upon the statistics in the US. From 1998 to 2012, on an annual basis, the breast cancer incidence growth rate is at around 0.5% on an annual basis. As you can see, in the Asian countries, for example, in Korea, premenopausal cancer is increasing at around 6% every year. And also postmenopausal, we see similar rates as well. Japan is showing similar trends. So the rate of cancer incidence increase is actually faster in Asian countries. That may be due to an actual higher level of cancer incidence, but at the same time, screening has become more widespread than in the past. So that is why we are catching many more cases. And the Asian countries, as they have gone through economic development, they are adopting more of a Western lifestyle, which is also related to the cause. One of the characteristics that we can see is that previously in Asian nations, for premenopausal women, we saw more breast cancer cases. For postmenopausal, we saw more hormone receptor negative type of cases in breast cancer, but more and more we see an increase in HER2 positive, and that is mostly due to a rise in Western types of lifestyles within Asian populations. And we also see some differences in characteristics for the age groups. For example, in Korea, we see more prevalence in 40s and 50s, whereas in Japan, it is the highest in the 60s and 70s. So once again, in terms of the age of onset, the fact that cancer is being diagnosed at a more active and earlier age, it means that it has become more important for us to be able to successfully treat the cancer cases. Despite this, on the whole, compared to other types of cancer, the survival rate is relatively thinking quite long. So after 5 years after diagnosis, it's at 91%, and 10 years after diagnosis, 84%, and 15 years after diagnosis, 80%. So definitely it is something that you can manage well with a good quality long survival rate. So what are the causes behind breast cancer that we're talking about right now? Cancer as a disease, it is caused by changes in the cells. So changes or mutations in the cell cause cancer. So genetic changes or DNA changes are causing cancer, and there are many causes that promote this type of change. Maybe dietary patterns or chemical or radiation or virus infections that may cause these types of things to be promoted. We do have inside our bodies some ability to alter these changes. However, that really depends on each individual. And so there are major signaling pathways in breast cancer development and progression. The most representative would be the estrogen receptor signal pathway, and you've probably heard a lot about the HER2 signal pathways as well. So these two areas are the most prevalent. Through these pathways, breast cancer can go through metastasis and develop into later stages. So hormone receptors, blocking those, I think many of you have gone through tamoxifen treatment and also labtinib as well as trastuzumab or pertuzumab, which are HER2 signal pathway blockers. So these types of agents have been developed, and we have been able to gain a better result in terms of successful treatment of breast cancer. Now, let's talk a little bit about the risk factors. What we have identified so far, there are many risk factors that we have identified. Age, family history, the gender, genetic changes, and hormonal changes. These things can affect the development of breast cancer. These things actually are things that we cannot modify and we cannot change. These are things that are given. First is that if you go through, for example, other types of patterns that may become risk factors, such as oral contraceptives or HRT, childbirth, breastfeeding, alcohol consumption, obesity, and physical activity, the things on the right-hand side are things that we can do something about, and therefore, those risk factors we can actually battle against. Let's look into some of the risk factors. The fact that we are women, the gender itself, brings about the biggest risk factor for developing breast cancer. If you look at the case of the US as well as in Korea, compared to female breast cancer, the male breast cancer cases is only 1% or less than 1% in the US and less than 0.5% in Korea. It may be due to the actual tissue differences, but also prior to the childbirth, breast cells are very immature and highly active, and therefore women's breast cells are very responsive to estrogen or hormone disruptors in the environment, and that therefore promotes the possibility of breast cancer risk. Compared to that, on the other hand, men's breast cells are inactive, and most men have extremely low levels of estrogen. And therefore, relatively speaking, for men, it's a very lower risk. Let's look at age. All cancer types actually have a higher level of risk as you get older. However, in the case of Korea, premenopausal women actually show more cases of breast cancer, so it seems to be safer when you get older. However, as I mentioned earlier, there are many genetic factors that are accumulated, and of course, as you get older, your body loses more and more the ability to cure itself, and that's why the prevalence may be higher at a higher age. Note, of course, that in Korea we have more younger cases, but in general, cancer prevalence is higher in the older ages. Now let's look at family history. When there is a family history, if you look at especially the immediate family, not cousins or second cousins, if you look at the parents, siblings, and children, if they have a history of breast cancer, then depending on how many patients are within that family, it may actually increase the risk factor. Having one person within your first-degree female relative having breast cancer, the hazard ratio is only 1.7, but more than 2, the hazard ratio will increase to over 2.5. However, of course, who that relative is it the mother, is it the sister, or is it daughter? It also differs, the hazard ratio. Also, the age of relative at diagnosis, that's actually very important in terms of influencing the hazard ratio. If the relative at diagnosis, the age was less than 45, then the hazard ratio goes beyond 2.4, whereas more than 45 years old, the hazard ratio drops. Another risk factor is genetic change. People who are diagnosed of breast cancer, about 5 to 10% of them are thought to be cancer patients from a hereditary cause, caused by abnormal genes that are passed from parent to child. These are called germline mutations. I think the most representative germline mutations that you've probably heard of would be BRCA1 or BRCA2 mutations. But outside of that, there's also CDH1 and PALB mutations that are known to be very highly correlated to breast cancer. So those who do not have these types of mutations, on average, they have a 12% risk of developing breast cancer. However, those that have these specific mutations, they have a much, much higher risk of developing breast cancer. So in the case of CDH1 mutation, about half of them have a risk of developing breast cancer. And for PALB2, it's about 45%. For BRCA1 and BRCA2, it's very high. So in this case, if I'm diagnosed with breast cancer, do I have these types of genetic mutations or not? It's something that you can identify to find out in advance whether it can have an impact on your children, on your daughters, for example. So that's why we go ahead and confirm these germline mutations with breast cancer cases. If you are diagnosed with breast cancer at an age that is younger than 45, these are actually guidelines of the US. In the case of Asia, we would probably have to make this earlier because we have more younger cases. So in the case of Korea, the guideline is less than 40 years of age. Breast cancer diagnosed at the age of between the 40s to 50s, with unknown or limited family history, or a second breast cancer diagnosed at any age with more than one close blood relative with breast, ovarian, pancreas, prostate cancer at any age, or triple negative breast cancer diagnosed at an age less than 60 years old. For all of these cases, we go ahead with BRCA1/2 mutation tests. The reason that we are very wary of this is that there's a cumulative risk for BRCA mutation carriers because they may have a higher level of risk for contralateral breast cancer, which means breast cancer appearing in both breasts. 5 years after the first breast cancer, for BRCA negative type of patients, only 28.4% of them have the possibility of having breast cancer being developed in the other breast, whereas for BRCA1 patients, it's higher at 55.1%, and for BRCA2 mutation carriers, 38.4%. So we must be aware of this fact in order to manage the risks better for these types of cases. As I mentioned earlier, obviously, female hormones have a large impact as a factor. So if you have early menarche or late menopause, these, of course, increase breast cancer risk. If you have started your periods at an age younger than 12, or if your menopause comes at an age later than 55, then you may have a higher level of breast cancer risk. So for each 1-year delay of menarche or for each 1-year delay in menopause, respectively, a 5% increase and 3% increase of breast cancer risk is expected. We also take into consideration another risk factor, which is breast density. You've probably done mammograms and you've seen the cases of dense breasts. In those cases, we can see those white areas in the mammograph where if you have dense breasts, you have a higher level of cancer risk. For level 4, which is extremely dense, there's 4.64 times higher cancer risk. In a prevention study using the agent tamoxifen, there was a 10% reduction of mammographic breast density. They experience 63% reduction in breast cancer risk. So those are the things that we have to take into consideration. So looking at family history, personal history of breast cancer, and looking at the age that you're diagnosed at, you should be aware that, for example, if you were diagnosed with breast cancer at younger than 40 years, then the cumulative risk becomes higher, as well as a diagnosis of breast cancer at over 6 years of age. It's actually much lesser in terms of risk of 0.5% per year. So if you have a personal history of these types of diseases that you see here on the slide, you may have a higher risk of breast cancer. Definitely that risk becomes higher if you have family history. If you have, for example, proliferative diseases such as papilloma or moderate ductal hyperplasia, that also increases the risk. So in the case of a typical ductal lobular hyperplasia, it increases the risk of about 4 times more. So we have to take into consideration these factors and be wary in terms of management. What are the types of treatments that we can adopt? First of all, there's hormone replacement therapy. But for long-term use of combination HRT, estrogen and progesterone, then breast cancer risk can be increased up to 70 to 100%. Compared to that, what is known to be less risky also do increase a little bit the risk. Estrogen alone types of hormonal therapy only increases the breast cancer risk to 14 to 17%. So breast cancer risk goes back down to average at around 2 years. But after you stop taking the combination HRT, we should also take into consideration just how much that treatment took place. You may think that if you start a treatment after menopause, it may not be that risky. However, after about 10 years, estrogen and progesterone levels may be 2 times higher than other average women. So you have to take into consideration that those are risk factors. Early menopause may be brought on through hormone replacement treatment. So in those cases, breast cancer recurrence may increase by 3.5 times and contralateral breast cancer also by 3.6 times. So we do not recommend for treatment menopausal symptoms in breast cancer survivors. Contraception is also another important risk factor to take into consideration. We look at the period of oral contraception. Current users have an increase of breast cancer risk of 20%. But those who have had oral contraception for a long time, for example, over 10 years, that risk goes up higher to 38%. For past users, after discontinuation, the risk of breast cancer was still quite high. So, of course, if you are prone to breast cancer or if you're a breast cancer patient, you have to take these into consideration. Of course, childbirth and breastfeeding have an influence as well. And another important thing that many people ask about is alcohol consumption. Yes, alcohol consumption increases the risk of breast cancer. If you are drinking daily with a consumption of 10 grams or above, then there's a almost 10% increase in the risk factor. If you consume alcohol more than 4 times a week, then the recurrence risk for breast cancer survivors may increase as well. So if, for example, you are drinking a glass of wine every day, thinking that is good for your health, for HR-positive breast cancer patients, if that is the case, then the risk of late recurrence increases by 28%. Obesity is another factor. For colon and breast cancer, it's a major cause, as you're well aware. So it's a high risk factor we have to think about because being overweight and being obese increases the level of inflammatory cytokines, which increases, therefore, the risk of breast cancer. For postmenopausal HR-positive breast cancer, the risk is increased to 30 to 40% by obesity. But for premenopausal, HR-negative and triple-negative types of breast cancer, there is still a risk that is occurring as well. Obese HR-positive patients, you must be aware that you have higher risk levels, so you have to be able to manage the obesity and deal with that disease. Physical activity with a frequency of 3 to 5 times a week reduces the risk of breast cancer, both for pre- and postmenopausal. For breast cancer survivors, walking fast or moderate intensity aerobic activity will reduce the risk of death from breast cancer. So, the take-home message as a conclusion is that breast cancer is the most frequent women cancer on a worldwide basis, and the incidence of breast cancer in Asian countries is lower than Western countries. However, the rate of increase, that is the growth rate, is higher in Asian countries. So knowing the risk factors will allow you to manage the risks. And if you modify the risk factors, we can actually change that risk level. With that, I'd like to conclude my presentation. Thank you for your attention.